Let's start with the introduction. Cystic kidney diseases are multisystemic disorders that can develop due to genetic or non-genetic causes in all age groups. There are many types of cystic kidney disease, some are common and some are rare. But one thing for sure is that cystic kidney disease causes sacs of fluid to form in or around the kidneys. On that account, this case study reviews the general information of cystic kidney diseases from the main cause, symptoms, factors that increase the risk of suffering a disease, disease prevention, and the treatments. Moving on to the main causes of the disease. Cystic kidney diseases come from many causes which are inherited from the parents' abnormal genes, developed from the wombs, acquired from having a kidney failure situation, and systemic disease related. In this case study, we will be explaining in detail about polycystic kidney disease on both autosomal recessive and autosomal dominant and nephronocytis for genetic cystic kidney disease, while we go for simple kidney cyst and multicystic dysplastic kidney for non-genetic cystic kidney disease. First, genetic cystic kidney disease, which is polycystic kidney disease (PKD). Autosomal dominant polycystic kidney disease, only one parent need to have the disease for it to pass to the children. If one parent has ADPKD, each child has a 50% chance of getting the disease. The second one is autosomal recessive polycystic kidney disease (ARPKD). Both parents must have abnormal genes to pass on this form of the disease. If both parents carry a gene for this disorder, each child has a 25% chance of getting the disease. The third one is nephronophthisis. Nephronophthisis is an autosomal recessive condition caused by NPHP1 to NPHP5 genes. As for the non-genetic cystic kidney disease, which first is simple cystic kidney. Developmental cystic kidney disease is caused due to abnormal development of the metanephros leading to a multicystic dysplastic kidney with reduced nephron induction. While for the multicystic dysplastic kidney, injury or microscopic blockage in the tubules are believed to be the main cause for the simple kidney disease.
Next, we go to the symptoms of the disease. The first one for the disease is the genetics kind, which is polycystic kidney disease or PKD and nephronophthisis or NPH. For PKD, we have two types, which is dominant and recessive PKD. For dominant PKD, the symptoms are headaches and muscle pain on back and side of the body, kidney stones, blood in urine, infection of urinary tract, and high blood pressure. For recessive PKD, before the baby was born, the symptoms are bigger kidney and insufficient amniotic fluids. After birth, the baby will have swollen stomach, breathing issues, and high blood pressure. And in childhood phase, the child will have high blood pressure and urinary tract infection. The next one is nephronophthisis, which is the symptoms are increase in urine production, severe thirst, acute fatigue, and overall weakness. After that, for non-genetics, we have two types, which is simple cystic kidney and multicystic dysplastic kidney. For simple cystic kidney, the symptoms are discomfort or pain in the bones, high blood pressure, upper stomach pain, obstruction of the flow of blood or urine in the kidney or urethras, and blood in urine. After that, for multicystic dysplastic kidney, the symptoms are one functional kidney, blockage of renal pelvis of kidney, abnormality of the valves in the kidney and bladder.
Now, I would like to discuss the factors that increase the risk of suffering a cystic kidney disease. Under genetic category, radiologic imaging shows caffeine-promoted cyst growth and enlargement in polycystic kidney disease. Consuming more than 4 cups of coffee and also alcohol beverages can raise blood pressure and significantly increase the risk of the disease. Next, we have nephronophthisis with a risk factor of diabetes. It thickens the nephrons and scar it over time, thus leakage can occur and cause nerve damage. Furthermore, non-steroidal anti-inflammatory drugs such as ibuprofen holds the ability to disrupt the kidney function. Moving on to the non-genetic category. First, the increase of age and the disease has a linear correlation. A theory claimed that kidney cyst develops at older age when the kidney surface enfeebled and form a sac, allowing fluid to enter and develop into cyst. Moreover, male with higher levels of testosterone contribute to hypersecretion of fluid and also liquid, resulting in increased cyst expansion. Let's continue with multicystic dysplastic kidney or MCDK. The factors remain unknown, however, according to experts, early blocking of the urine's flow or genetic mutation are the factors for the rarity of MCDK. Based on studies, MCDK was linked to prenatal viral infection exposure. Air pollution and also metal exposure are significant environmental risk factors, but it is unknown how much age contributes to kidney disease.
Next, I will explain about the most popular treatment for cystic kidney disease. In genetic, first is polycystic kidney disease, PKD. In PKD, it focuses on preventing or delaying the loss of kidney function, helping slow the growth of cysts, and controlling symptoms such as high blood pressure, urinary tract infection, and preventing complications. So the treatment for controlling symptoms including avoiding caffeine, drinking lots of plain water, controlling blood pressure, and taking antibiotic for treat UTI. However, if the kidney stop working, it may require dialysis or a kidney transplant. The second one is nephronophthisis (NPH). The treatment involves managing the symptoms such as the correction of water and electrolyte imbalance, as well as anemia and high blood pressure. Although this treatment can help to prevent the rapid decline of renal function, it does not prevent the progressive to end-stage renal disease. So, if the patient is in end-stage renal disease, it requires dialysis or kidney transplant. Next is non-genetic. First is simple kidney cystic. It does not need any treatment since it is harmless and does not cause any symptom. However, if there are symptoms affecting the kidney works, especially if it prevents blood or urine from passing through the kidney, it is necessary to drain and remove the cyst. There are two common treatments used to treat simple kidney cystic. First is aspiration and sclerotherapy. Second treatment is through surgery. Second is multicystic dysplastic kidney, MCDK. There is no specific treatment for MCDK. However, the patient will be monitored by the expert through a series of ultrasonic examination until the MCDK totally regress and disappear, leaving the patient to have only one healthy kidney. Another option is by having surgery might be necessary if the MCDK is still there and growing larger.
My name is Muhammad Safidin Mawarosli. I will present to you about the disease prevention and control. Firstly, polycystic disease or PKD. According to current research, further studies are required by the researcher before the medicine for the disease may be utilized on patients. However, many supportive treatment can be used in the meantime to help patients with PKD to manage their symptoms. This consists of monitoring blood pressure closely, avoiding any beverage with caffeine, and antibiotic should be used right away if you have a kidney or bladder infection. Next, for nephronophthisis or NPH. We can slow the progression of NPH by doing a treatment for any current proteinuria, hypertension, and anemia. However, adult and pediatric patients may receive different preferred treatment based on kidney disease improving global outcome, KDI-GO. Thirdly, simple kidney disease, which has developed in 33% of American adults from diabetes, high blood pressure, heart disease, a family history of renal disease, and obesity based on National Kidney Foundation research. However, you can lessen your risk of developing kidney disease by control of blood sugar, eat a balanced diet, and exercise. Meanwhile, multicystic dysplastic kidney or MCDK, there is no way to stop the development of the disease. However, there are additional precautions consist of preventing kidney damage by treating a urinary tract infection and reducing alcohol consumption. To conclude our research, cystic kidney disease is a common name for the disease because specifically there are other names such as polycystic, nephronophthisis, simple cystic kidney, and multicystic dysplastic kidney. This mentioned disease can be classified into genetic or non-genetic disease. Therefore, some have treatment methods and some are still under research. However, this disease cannot be avoided, but the process can be slowed down by practicing a healthy lifestyle and doing a medical checkup to ensure that the kidney are functioning properly.